Hello, in this video I'll be talking about exercise and trying to answer the question, does exercise reduce the risk of cancer recurrence? Before I go on, I'd love to invite you to subscribe to our channel. We have other videos on diet and exercise and other things to help you stay healthy and even perhaps reduce the risk of recurrence. I'd also love to invite you to go to Yerbba.com to get your personalized Yerbba report. Knowing several key features about your tumor may help you decide if this information is relevant in your case. I'm going to talk about a study that was published in the Journal of Clinical Oncology earlier this year, which is 2024. In this study, which was conducted in France, over 10,000 patients who had had breast cancer were followed for many years. The study was conducted between 2012 and 2018, and then people were followed after that. And the study looked at the amount of exercise that people did before they were diagnosed. So you might be wondering, will it matter if I exercise now? We tend to take this kind of information and say it's a signal for what it might mean for you in terms of exercising now. And the outcome was looking for recurrence of cancer. The investigators pre-planned some subgroup analyses. So they looked at how people did based on their hormone receptor status and how they did in terms of recurrence based on pre- or postmenopausal status at the time of diagnosis. In the study, they found that people who exercised between 90 minutes and 5 hours a week at a moderate intensity, which is being able to speak but not sing, had a lower risk of recurrence. I'll say that one more time. People who exercised between 90 minutes a week and 5 hours a week were less likely to have a metastatic recurrence of their cancer. And that exercise was the exercise they reported before they were diagnosed. So it did rely on self-report. There were no devices attached to the person to see how much they were exercising. We do know self-report is actually pretty good for exercise, not so good for eating, but pretty good for exercise because people tend to pay attention to how much exercise they get. The people who benefited the most were premenopausal women. The benefit of exercise was not seen in postmenopausal women in this study. And the other thing to know is that the people who benefited had hormone receptor negative tumors. People with hormone receptor positive tumors, we did not see the benefit. That does not mean there is no benefit. The absence of data doesn't mean the absence of benefit. What are the takeaways from this? Well, I want to put some sort of parentheses or caveats around this. We know that people who are able to exercise between 90 minutes and 5 hours a week have a lifestyle that allows that. They are not working 2 jobs or 3 jobs. They have somebody to watch their kids while they exercise. They have the means to be able to exercise, buy equipment, or join a club, or have a trainer. So we already know that those folks are already going to do better just on the basis of their socioeconomic position. Another caveat is that in terms of what this means to you, if you have been diagnosed with breast cancer, this all related to exercise before the diagnosis. One of the harms of these studies is if you weren't exercising 90 minutes to 5 hours a week before you were diagnosed, are you going to leave with, I've caused my breast cancer, or I've caused my recurrence, or oh, I've done it now? Absolutely not. It's really important to know that these studies are useful and give us a signal of things that we can do. But frankly, you already knew that exercising 4 to 5 times a week for 30 to 60 minutes was the right thing to do, and there are reasons you didn't do it. Not because you're lazy, not because you're stupid, but because you weren't able to fit it into your life, or maybe you just really hate exercise. So these are the caveats and sort of the things that I think we need to think about big picture wise. In terms of your implications, what do you do now? There's so many benefits to exercise. It's good for your brain, your mood, your sex drive, maybe breast cancer recurrence. It's so good for your life and your joints. It helps you stay mobile. It's good for so many things that exercising, I actually call it movement because I don't like exercise, but I love movement. That doing some form of movement every day and starting with walking or starting with lifting a few weights or going to the YMCA if you live in the United States or finding a group of people to exercise or move with can be a great strategy. If you are an exercise expert, I'd love to hear your thoughts about this study. We have a link to the actual article that we'll provide so you can take a look at it as well. And if you have started movement after being diagnosed with breast cancer, tell us about it. What did you do? How did you make that change? Because it is a change that can be hard to make. As always, thank you for watching, and we'll see you next time.